Hello, my name is Amira Abbasi and I'll be your psychiatrist. As stated in Marvel films, the God of Thunder Thor has not been feeling himself lately. Thor has recently lost both of his parents. He had to kill his own sister, Hela, the goddess of death, so she wouldn't take over the entire universe. In killing his sister, his home for centuries, Asgard, was blown into flames, demolished, and unrebuildable. While moving his people to a new home, he encountered the most powerful being in the universe, Thanos, who not only obliterated the ship his people were on, but ended up killing Thor's brother, Loki. Thor is traumatized from seeing his brother Loki die a third time, only this time knowing he will never ever see his brother again. Later on, losing yet another battle with Thanos, only this time the result of losing everyone he loves, even half the world's population. Since Thanos had been the only celestial being Thor has ever lost to, he becomes more and more distant. For months, he replays the same scenarios in his head. For months, he doesn't sleep or leave his house. He stays in his house, only binge drinking beer, thus affecting his physical appearance for the worse. He does not care about anyone or anything, and his self-esteem is at an all-time low. He is blaming everything that happened on himself and is centering his emotions towards the tragedies of the past. He is not centering his emotions towards the present. Thor continuously falls in a greater sense of depression due to the immense sense of blaming he has on himself. Thinking all this is his fault and being in a state of depression for over 5 years leads me to believe that Thor has major depressive disorder. Major depressive disorder, or MDD, also known as depression, is a mental disorder characterized by at least 2 weeks of low mood that is present across situations. It is often accompanied by low self-esteem, loss of interest in normal, enjoyable activities, low energy, and pain without a clear cause. I present Thor with this diagnosis because he has been depressed for over 5 years. He has been blaming and putting too much pressure on himself, and it's bringing his self-esteem down. One kind of talk therapy I would like to use with Thor is dialectic behavioral therapy. It is a therapy of cognitive it is a type of cognitive behavioral therapy. Dialectic behavioral therapy has been proven useful in treating mood disorders like major depressive disorder. One biomedical therapy I would use on Thor is electric convulsive therapy or electric shock therapy. It is a psychiatric treatment in which seizures are electrically induced its patients to provide relief from mental disorder. The treatment therapy uses 70 to 120 volts of pulse electricity, which is applied externally to the patient's head, resulting in approximately 800 millihertz of direct current passed through the brain for 100 milliseconds to 6 seconds duration. Electric shock therapy is considered a safe and effective intervention for major depressive disorder. One advantage for dialectic behavioral therapy is that it decreases suicide rates and self-harming behavior. Being depressed can cause self-harming behavior, and dialectic behavioral therapy helps. One disadvantage for dialectic behavioral therapy is that while dialectic behavioral therapy is focused on helping patients to better manage their emotions, sometimes some patients don't see the same results and end up end treatment before it is finished. An advantage for electric shock therapy is that it is extremely effective. However, it could hurt the patient depending on the severity of the patient's needs. Thor has been also presenting signs of lack of his enjoyable activities, such as working out and saving worlds. His defeat has thrown him off course, creating an imbalance in the universe. However, with dialectic behavioral therapy and electric convulsive therapy or shock therapy, I am sure Thor's major depressive disorder will be cured in a matter of months. Thank you.